Joining us now on the Megacast is one of over 300 charities and nonprofits supported on the Shared Detroit platform. Mary Naber is the president and CEO of PACE of Southeastern Michigan and joins us on the program now. Mary, thanks for joining us today.
Good morning. Hello, Tyler. How are you?
I'm great. How are you doing today, Mary?
Very well, thanks.
Glad to have you on to talk about this. So tell us about the history of PACE and the mission of your organization, how it helps people here in Southeastern Michigan.
Okay, so the best way to describe what we do is that we take care of chronically ill, older adults who would otherwise be in the nursing home if they weren't in PACE. We kind of wrap our arms around them and take care of the whole person, their body, mind, and spirit, keeping them independent in the community, hopefully to the end of their life. Our mission is to keep them out of a nursing home. We've been in business for over 30 years. PACE stands for Program of All-Inclusive Care for the Elderly. There are 148 programs across the country. There are 14 in the state of Michigan. It is a partnership between CMS, Centers for basically Medicare Services, and the state Medicaid department. So most of the people we take care of are chronically ill, older adults who want to remain independent in the community. And they are low income.
And to do that, it requires a number of different services in order to help support some of those different efforts that go into living a long and healthy life outside of a nursing home or another assisted care facility. So what are some of those services that you are providing to individuals through PACE?
Well, first of all, what is unique about us is that we're their insurance company. So we pay for everything that they need. There is nothing out of pocket for them. And our funding comes from Medicare and Medicaid. And then all that we provide is basically what that individual needs to keep them in the community. We transport them. We have a fleet of 150 buses across Southeast Michigan. We transport them to and from our centers. We have these health centers, and inside the health centers, we have urgent care clinics where we provide primary care to all of our participants. That's what we call them. We have a full rehab gym that they can access whenever and as often as they need. And we have full day centers where they have cognitive stimulation and socialization and activities to keep them interested and engaged in with one another. So the other kind of services that we provide is that everyone is assigned a nurse and a social worker and a primary care team. And in that, there are additional physical therapists. There's occupational therapy. We provide all the medications. We support them with their behavioral health, mental health needs. We provide at-home services, including private duty type of services, which means we help them with daily activities of living, showering, transferring to and from their wheelchair to their chair, those kinds of things, to their bed. We provide nutritional counseling. We have dietitians on staff. We have pharmacists on staff. We have speech therapy. You name it, we probably provide it. We even do laundry services. As I said, we kind of wrap our arms around them and provide everything they need to keep them independent in the community. These are very chronically ill older adults.
And you mentioned too, they're often in lower income situations too, and when
Yes.
that is a factor, in those situations, these individuals may still be working, or may have just gotten to a point where they can no longer work, and that income and possibly even that insurance that they would have through their employer may not be there. So in those situations where someone is in need of that care and in need of those services quite rapidly, how do people get involved? How do people then get into contact and have the services available to them through PACE?
Okay, we have several ways that they can contact us. There is an eligibility for the program that people need to meet, and we have an intake service that will ask questions and make sure that people meet the requirements of the program. But they can call our main number, 855-445-4554, and you press number 2, and you'll speak to our enrollment specialist. You can also go to our website, www.pacesemi.org. That's PACESEMI.org, and click Contact Us, the tab, and do general inquiry. The last way is you can always email us at info@pacesemi.org. And those are the three best ways. I'll say the best way is really by calling us, 855-445-4554. And our enrollment specialist will talk to you and ask you questions and determine whether or not you meet the eligibility of the program.
And sometimes it's best to, Mary, for these individuals and for their families to have that consultation also happen in person. I understand that you have locations throughout southeastern Michigan for people if they're in need of some of these services or to discuss some of these issues. Tell us about those locations and what are provided by those different areas.
Yes, we have centers throughout, we have currently 7 centers throughout Southeast Michigan, and these are actually health facilities. And we also have a corporate office that's located on Northwestern in Southfield. The centers, we have 2 in Detroit, one in Rivertown and the other one in Detroit Northwest in that old Redford area. We have one in Dearborn, we have one in East Point, one in Southfield, one in Sterling Heights, one in Pontiac, and soon to be, our 8th center will be in Clinton Township. As you can tell, there's a great need to provide this kind of supportive life care to seniors in need who are chronically ill, to keep them out of environments like institutional living.
More information.
Our corporate office,
please.
do you want to know where that is located? It's 21700 Northwestern Highway in Southfield.
More information can be found on PACE by visiting the website pacesemi.org. That's PACESEMI or PACE Southeastern Michigan.org for more information. You can also call them 855-445-4554, 855-445-4554 for more information. Joining us on today's edition of the Megacast is Mary Naber, the president and CEO of PACE of Southeastern Michigan. You can also learn more about them by searching PACE of Southeastern Michigan on Share Detroit's website at sharedetroit.org. Just go into their Find a Nonprofit section to learn more information about PACE and their services. In terms of the ways that this does help these individuals continue to live a longer life, a healthier life, especially in those later years and in their socioeconomic situation, just how much of a difference does having PACE's services in their life and available to them make in having those more positive outcomes near the end of their life?
Oh, I think there are multiple ways in which, if you were to talk to our participants, many of them who enter the program after having a stroke cannot walk. But by being in the program, there's a lady right now at Sterling Heights who just showed me how she was dancing, and she could not walk a year ago. So the quality of life improves. The socialization, the cognitive stimulation, the support to the caregivers. If they have family members who've been providing care, we can help support them in the way that we provide care, because they come to our centers sometimes 3 days a week, sometimes 5 days a week, depends on what that person needs and what that family needs. So there's a lot of supportive needs. There's also research that says that people who chronically ill older adults who are in PACE live longer, live a higher quality of life, and there's research to support that.
Again, more information can be found on sharedetroit.org or pacesemi.org. Directly from PACE of Southeastern Michigan. You can also call them 855-445-4554 for information and inquiries as well. And we're joined today by Mary Naber, the president and CEO of PACE of Southeastern Michigan, on today's edition of the Megacast. Again, just their website one more time can be found, PACE, S-E-M-I, or pacesemi.org. For more information. Mary, a couple more minutes with you before we'll need to say goodbye today. Anything else we haven't discussed yet on PACE and its services that you'd like our audience to know, or other ways that the community can also help support these programs?
Yes, there's 2 things I'd like to say. One is that, of course, we're experiencing the short staffing that everyone else is. But I think what's really unique about what we offer in the healthcare world is that we hire all the disciplines. We're hiring drivers, we're hiring nurses assistants. We have a job fair tomorrow at our corporate office from 12 to 5 for all those roles, nurses, physical therapists, occupational therapy, etc. And we'll have another job fair on February 15th from noon to 5:30 at our Pontiac Center, which is located at 823 Golf Drive in Pontiac. So we're always hiring. We think we pay a very marketable rate, and our benefits are extra competitive. I'll just say it that way. So if you're interested, please come and see us, or contact us on our website and press careers and take a look at what we've got. The other thing I wanted to mention is that we always have opportunity for volunteers and donations. Our donations go directly to our participants to keep them independent in their community. The program can only pay for so much related to health care, but if they need a new mattress, if they have a leaky roof that needs repairing on their old home, that's what we use our donations for. So for both of those things, you go to our website, www.pacesemi.org, press volunteers if you'd like to volunteer, and press donations if you'd like to donate. We'd love to have more people participate in our community.
Always a number of different ways that you can help not only PACE of Southeastern Michigan, but organizations all throughout the Metro Detroit area. Learn more information on all those on Share Detroit's website at sharedetroit.org. Mary, thank you so much for joining us.
Thank you so much.